Hello everyone, here's the new lesson. It will be about Clostridium genus and it will have a little bit new style. Hopefully you will enjoy it. Well, the topic is Clostridium genus and anaerobic infections. As well as you can know, all of the bacteria can be divided and classified by the respiration, by type of respiration, and here you can see the classification. It can be aerobic respiration, just with oxygen. It can be anaerobic respiration, just without oxygen, and it can be facultative aerobic with both, without and with oxygen. And the last one is capnophilic, when bacteria is using CO2 for respiration. Here's the genus Clostridium. What you need to know about the genus Clostridium is that it is a group of strictly anaerobic gram-positive bacteria which have the ability to produce a special type of dormant cells, which are called endospores. And Clostridium was discovered by the French microbiologist Louis Pasteur in the 1860s as a proof of existing of anaerobic microorganisms. Here are several diseases caused by Clostridia, but three of them we will discuss closer. It is botulism, which is caused by Clostridium botulinum. It is soft tissue infection or gangrene, which is produced by Clostridium perfringens, and tetanus, the disease caused by Clostridium tetani. Here you can see the picture of the smear made from the pus of a mixed anaerobic infection, and here we can see at least three types of clostridial infections, clostridial bacteria. Here you can see three different types, some of them with and some of them without spores. The first one is gas gangrene. Gas gangrene is the mostly common infection which is associated to war wound. So in the battlefield, especially in past, it was used to be a cause of loss of limbs in soldiers which had deep wounds. Usually they were contaminated with soil, which is rich in spores of Clostridia, including gas gangrene, including Clostridium perfringens. Regarding toxins, you can see the entire list of toxins produced by the Clostridium perfringens, and the mostly important of them is alpha toxin. Regarding investigation, we use few methods. First one is microscopic, so we just need to take the sample from the wound and to find the gram-positive bacteria, rod shape, and some of them will be with spores. Also, we can look for capsule. Clostridium perfringens will have capsule, but there are also few species which also can cause gas gangrene, such as Clostridium septicum or others, and such bacteria will also be motile, so we can make test for motility. Bacteriological investigation, that means we will culture the bacteria, and as well as you could remember from the last semester when we was talking about investigation of anaerobic bacteria and about culturing of anaerobic bacteria. There are a few ways to provide anaerobic conditions for anaerobes. So in bacteriological investigation, the mostly important feature, the mostly important factor we will apply will be, of course, anaerobiosis. As well, in the infection, the mostly important factor is anaerobiosis. So this is why the wound should be deep in order to produce an infection. And of course it should be contaminated with usually with soil, with ashes, with maybe feces, with dust from the outside, even contamination with own feces or with animals' feces can cause an infection, since Clostridium species are present. Clostridium genus is present in gastrointestinal tract of humans and animals. And in order to make difference between simple gangrene and gas gangrene, you can see swallowing in the gas gangrene. In simple gangrene, there are different mechanisms which are producing damage and death of the tissue. So the supply of oxygen becomes impossible and the tissue is starting dying. This is why whenever we have simple gangrene, the color of tissue will be closer to black, sometimes maybe a little bit greenish, and the cause of the gangrene can be hypoxia or intoxication or other infections. Whenever we are talking about gas gangrene, the Clostridium perfringens or Clostridium septicum or Clostridium histolyticum, they are able to produce toxins and gas. So this gas will increase and will be produced in the entire tissue, which will cause uh, trouble in supply of the tissue with oxygen. Regarding biological test, you can remind that microscopic test is simple. We are applying staining and look on the bacteria under the microscope. Bacteriological one, we culture the bacteria on the culture media in specific conditions, and biological investigation is when you inoculate the lab animals and you observe the symptoms which the pathogen can produce while producing infection. And express test, for example, indirect fluorescence antibodies. But basically, usually you can understand according to the symptoms what has the patient, so you don't really need to make that investigation before you will start the treatment. Regarding the treatment, on the first place, if we are talking about etiological treatment, of course will be antibiotical treatment. But since we are talking about a necrotic process, about an inflammation which causes gangrene, of course you cannot avoid surgical treatment, and namely as soon as possible you should cut out or amputate the damaged tissue as soon as possible. And also, as a treatment, you can apply hyperbaric oxygen therapy, which will help the patient to increase the pressure of oxygen in the bloodstream. It will increase the speed of recovering, and it will decrease multiplication of bacteria, and will decrease its opportunity to produce toxins and gas. In this way, you also can prevent the development of the disease. Here's another infection caused by Clostridium tetani, and this infection also is an obligate anaerobic bacillus, which is gram-positive, and this infection is extremely dangerous. It's extremely dangerous because the bacteria is producing tetanic toxin, which affects too much nervous system, and especially it affects muscles. Well, the mechanism of action of tetanic toxin, this toxin is acting upon neurotransmitters, as well as you could remember from physiology. The function of muscle is double. Muscle can contract and muscle can relax. So for both of these functions are responsible different opposite neurotransmitters, which are sending different signals to muscles. In case of tetanus and action of tetanic toxin, the tetanic toxin will block the neurotransmitter which produces relaxation of muscles. In this way, muscles will all of the body muscles, skeletal muscles, will lose their ability to relax, and all of muscles will start contracting. And this contraction will increase as more bacteria will multiply in the body, as more it will produce the toxin. As more it will produce the toxin, as more contraction will happen. And here in the picture you can see the classical position of the person which has severe form or late form of tetanus. You can observe that some muscles are contracted stronger than others. For example, you know that we have flexors and extensors, so usually flexors are stronger. Also we have spinal muscles and abdominal muscles, and usually spinal muscles are stronger. Also we have legs, we have foot, we have feet, and usually all of flexors are stronger. This is why it will produce this arc. It will produce this kind of in form of rainbow, maybe. But it is a terminal form. How will look the symptom? How will look symptoms of tetanus? But in the beginning, it will produce just muscular rigidness, like the patient is not able to, the infected person is not able to talk. The muscles of face, of head, of neck are starting contracting. So, for example, the person will not be able to open the mouth in order to talk, or the person will have stiff neck. Sometimes you can misuse these symptoms with meningitis, in which also you have stiff neck and muscular pain. But in tetanus, the contraction will increase, the pain will increase, and the patient will stay conscious. Also, it can produce headache, fever, and sweating, and it will change blood pressure or will produce fast heart beating. According to the WHO, tetanus is diagnosed on the basis of clinical features, and it doesn't require the lab confirmation. So it is to be treated as soon as possible. And also, it is important to know that neonatal tetanus is highly spread in low-income countries. So some children some newborns are more affected, more supposed to get tetanus if in the country is not applied vaccination. Anyways, if we want to discover the pathogen, the lab investigation will be similar for all clostridial infections as for gas gangrene, as for tetanus, as for botulism. It will be quite similar. And here in this picture you can also see symptoms, how will look the newborn with tetanus. It is really severe infection which will produce a lot of suffering. Regarding prophylaxis and treatment, prophylaxis of course is vaccination, is immunoprophylaxis, which starts in childhood with vaccination with mixed vaccine, which is called DTP, against diphtheria, tetanus, and pertussis, or whooping cough. And it is taken in few doses, in few steps, and after immunity is developed, it is to be retaken. The vaccine is to be retaken every 5 or 10 years. This distance will be different in different countries. So different countries, they have their immunization plan for the population, and the average duration of the immunity for tetanus is between 5 and 10 years. Regarding treatment, even if antibiotics are applied and also corticosteroids are applied, but very important is passive immunization. Passive immunization, which means introduction of homologous or heterologous serum, immune serum. That means introduction intravenously or intramuscular of immunoglobulins produced in humans or in animals. Usually they are produced in cattle or in horses. The next infection is botulism, and it is also a very important infection because even if it is not spread too much as an infection, like there are not too much conditions in which a human can get this infection. Anyways, botulism is extremely toxic infection. It is actually it's a food poisoning because not the bacteria itself is producing damage in the body, but the toxin which were accumulated in the food. This is why incubation period is extremely short in botulism, because actually it doesn't require time for bacteria to multiply inside the body. But the toxin almost instantly from the moment it gets in the bloodstream and it gets to uh, central nervous system, it starts producing symptoms. Well, regarding pathogenesis, it can be ingestion of preformed toxin, it can be inhalation of toxin, it can be local production of toxin by Clostridium botulinum organism in the gastrointestinal tract. In this case, incubation will be a little bit longer. And for this case, of course, you also need you also will need mm, anaerobic conditions. Also, local production of the toxin uh, by microorganisms in dead tissues or on the wound side, and also there is a iatrogenic exposure caused by injection of botulinic toxin for cosmetic purposes. So it is also a very important issue because if such procedures are not performed by specialists and are not performed in the right conditions, in medical condition, in clean, sterile condition, with certified uh, products. There are too much cases of side effects and it can produce very bad damage, especially if we will think about the purpose of such treatment or such application of the botulinic toxin. So it can affect too much face and the appearance of the person. Here are here you can see the pretty common symptom of botulism. If tetanus is producing the spasm, the contraction of muscles, botulinic toxin leads to paralysis. So it also affects nervous system, but it can lead to paralysis. And it will start from up to down. It can start from eyes, so the eyes will be closed. It will be extremely hard for patient to open his eyes. Sometimes it can affect also nerves of muscles of the eyes, so it can produce crossed-eyed syndrome, and if the patient has double vision, it can be also a symptom. And all of symptoms, if are not treated on time, if are not treated as soon as possible, all of the symptoms are going from up to down, and finally they can affect respiratory system, and if the dosage of the toxin, of the ingested toxin, is too big and the treatment didn't start, it can produce respiratory dysfunction up to the respiratory stop, and it can affect other vital functions of the body. Regarding diagnosis, it is also, as tetanus, it is based on clinical history, but also can be examined after. Well, examination can be followed with laboratory confirmation, but anyways, we shouldn't wait for results from the lab. We should check all the symptoms, and we should start the treatment as soon as possible. Regarding prevention, all you need to know is you should pay attention to homemade cans, especially homemade cans with mushrooms, with meat, with fruits which could be contaminated with soil, and especially cans which are conservated, which are closed more than 2 years. Also, if the cap of the can is swallowed, you should also pay attention, because it can it can contain some pathogens. One more important thing: botulism doesn't produce any smell, doesn't produce any taste. Other bacteria, saprophytes, other bacteria which are spoiling, which are rooting the foods, they will produce smell, they will produce a specific taste or color. Botulinic toxin and botulism will not. This is why it can be just expired, but it will look okay, and the person will take it and will get infected, will get poisoned. Regarding the treatment, usually, since it is usually food poisoning but not food infection, it is not the first line treatment application of antibiotics. The first line treatment is application of immune serum, serum with antibodies. And of course, you should apply it as soon as possible, because if you will apply it later, it is you have a high risk to get to make symptoms unstoppable and irreversible. So the clinic, on the one moment, the clinic is becoming irreversible if you don't apply the treatment on time. Will not give any result, because it will be too late. So that's all. If you have any questions or any feedback, please feel free to ask, and see you next time.